Hello, everyone, and welcome. Welcome. You are in the cross sector collaboration of rural resources and agencies on family services session. We're glad you're here, and we'll get started in just a minute. I'd like to review a few housekeeping items. As a reminder, we are committed to accountable and safe spaces. If at any time you experience issues and need assistance, please reach out to me, Yasmina, hello, by sending me a direct message. To walk you through the tools of this session, just take a quick look at the vertical bar featuring the icons on the right side of your screen. If your event feed is open still because you've been socializing, you can close that event feed box by clicking on the X in the upper right-hand corner. The event feed is like a chat box for the entire event, and the chat box is just for this session. Once you've closed the event feed, you'll be able to see a vertical bar with several icons. You'll see speech bubbles. That is an important one. It's the Q&A, similar to our keynote if you just joined us. And if you have a question for our presenter, that's where I'd like you to put it, because I'm going to be managing that. The last icon that I need you to know about is the survey checklist icon at the bottom. We encourage you to click on that one and complete it before leaving the session. The final icon looks like a puzzle piece, and that's the one you can use to toggle your closed captioning on and off. So to enable me to keep up with the questions, if you have any for Yvonne, we ask that you please use just the Q&A button and feel free to use the chat for emojis and encouragement. It is now my pleasure, without further ado, to introduce Yvonne Posada. She is a mother, a student, and a lifelong resident of a rural community. She's also a family peer support professional. Thank you, Yvonne. You can turn your camera and microphone on whenever you're ready, and the stage is yours.
Thank you, Yasmina. I will start my slideshow. Thank you all so much for joining. Today's topic is over social determinants of health, impacts of cross-sector collaboration of rural resources and agencies on family services. I'm excited to present today and share my story and everything I've been working on to improve rural wellness in our communities. I am, as she mentioned, a social work student. I am interested in children and family, which sparked my desire to study behavioral health. And it led me to focus on finding answers to improving rural overall wellness and specifically to reversing suicide from deaths occurring. To be inclusive, I wanted to introduce myself as a white cisgender female, and I'm currently working on an undergraduate degree in social work at Texas A&M Commerce University. I am recently going to graduate on the 13th. I have been accepted into continuing to pursue my graduate degree in social work at Commerce. And my background is as a Texas Rural Family Partner and a TRIO McNair Scholar, which provides a dual perspective into the underlying factors and outcomes of the economic instability, the lack of social and community context, and poor health and healthcare systems. And I want to give a special thank you to Dr. Averill Knox and my field instructor, Bill Wilson, and my field liaison. And I also want to give a special acknowledgement to the opportunity to be able to serve community and preserving quality to future generations. And the objectives of today's topic I want to include is diversity, engagement, and the value of relevance of today's important issue. This research touches lived experiences of families with mental health, low social economic status, rural geographical locations on the basis and focus of rural wellness factors of the proposed findings. It will provide simple solutions for everyone that can implement. And the value is that it supports children and families with mental health challenges through integration of information with behavioral health resources for better outcomes. And this is relevant because its innovative research ties complex barriers to solutions and improving wellness across all sectors. In the chat box, I'd like you to submit an emoji of your experiences with peer providers. And Yasmina, I'll let you check that and let me know.
I was microphone muted 3 years into virtual working. We have heart eyes emojis from Stephanie in Essex County, New York. Does anybody else have any emojis that they would like to use with their experience? We have smiley faces from Davia. We got thumbs up. Anybody have like question marks? Anybody not worked with peer providers before? Thank you, Tara. Tara's the one giving us a fun thumbs up. So it looks like you have a crowd of people who are pretty enthusiastic about peer providers. So that's good news. And I think I can hide myself now. Oh, another thumbs up from Sonia. Thanks, Sonia.
Well, thank you so much for responding, and I'm really excited that everyone does have a positive experience with peer providers, and that there's a good audience that is familiar with peer providers. Thank you. Next, I would like to introduce Rick Johnson. Rick Johnson is a son, a brother, and a husband. This is Rick Johnson at 8 months as a baby, again at 7 years, and then as a husband, he's 34. And I want to highlight, as I introduce Rick Johnson, he lives in a rural area. He is self-employed in a high-paying job. He rents an apartment, owns his own vehicle. He's a high school graduate, and he is of dominant ethnicity. And I want to be able to introduce Rick Johnson, and I will bring up important relevance to why I'm introducing him today. So let's get into it. What is cross-sector collaboration? It is defined as a policy trend where nonprofits and government come together to address problems that cannot be solved by one sector alone. And I found this quote from Mosley, 2021 on page 1. And some areas that drove the data collection and the background of this research is to be able to demonstrate solution-based impacts that cross-sector collaboration has on improving wellness and capacity of Texas rural communities. Texas rural area of Fannin County has consistently high rates of disparity, suicide, and severity of poverty based on previous literature. And it also was based on my experience in the fieldwork and discussions with my field instructor. And an example of this type of data would include a cross-sector collaboration. What is your health indicator? What do these words look like? High rates of disparity, suicide, and severity of poverty. I just want to take a moment, look at the pictures in detail, and what comes to your mind. I would like to highlight the pancake. It has fresh fruit. There's strawberry, oranges, and apples, and some grapes. And what mother or father would not like to serve their children a healthy breakfast on Saturday morning and be able to provide fresh fruit and something that's delicious for their children? The reality of a health indicator is that rural food banks are really limited on fresh fruit. And the picture below it is typically what a family would get or individuals get at a food bank. And most likely, they wouldn't have a bag of Biscuit pancake mix. And the fresh fruit, if they do have it, would most likely be close to expiration. And I also want to highlight in the person sitting in a chair in the bottom left corner the word alone or unwanted. The research question that I want to propose, there are three. Will rural Texas communities improve social determinants of health outcomes if they integrate medical, behavioral health, and social services resources into a cross-sector collaboration? If Texas rural communities do integrate medical, behavioral health, and social resources into a cross-sector collaboration, then the social determinants of health statistical data outcomes will improve in a positive trajectory. And lastly, is Fannin County ready to accept the challenge to improve their social determinants of health data so they can move forward in providing a positive holistic health outcomes within the community? And the questions I would like to propose today to you: is your county ready to accept the challenge to improve your social determinants of health data individually? And are you ready to accept the challenge to improve your community's determinants of health data as a community? And the significance of today's visit and topic is the importance of this proposed research is to replicate evidence-based programs, interventions, and strategies for improving wellness social determinants of health indicators in rural Texas communities to effectively move forward in a positive directory. I'd also like today, I'm grateful to be able to speak to you today because this in itself raises awareness. And it's educating shared family leaders to effectively move forward as a community in a positive direction. Next, I would like to highlight some theoretical framework to be able to give that evidence-based background to it. The three I'd like to highlight is positive psychology, Erickson's psychosocial stages of development, and holistic theory. And first is the positive psychology. I just want to explain a little bit to give some context. Brugman 2014 explains emphasis of strength-based approach of people's capacities, behaviors, and growth. The potential positive meaning from stressful experiences is the positive psychology approach to it. Combine that with the Erickson psychosocial stages of development. Zatro 2019 explains that the fourth and seventh stages of development, the fourth one is a school age, which is industry versus infority, and generativity versus stagnation, which is equivalent to middle adulthood. To explain the industry versus infority stage, it develops the sense of competence and efficacy, the I can do it. Given the ability to gain pride and encouragement through activities, through school, family, and social activities, through parents, teachers, and coaches. And this is important because later they can achieve and hit important milestones, such as graduation, seeking jobs, volunteer opportunities, promotion, continuing higher education, and most importantly, living independent, such as establishing bank accounts, being able to own a car, pay insurance, etc. And the seventh one, the generative versus stagnation, putting these together is important because it provides a sense of productivity and accomplishment, and it makes, and with the individual, they make contributions in life. In this stage, is, as I highlighted and pointed out, is important and critical for success of community involvement, communities, social inclusion, and workforce development. And this is referenced in the notes. And the last framework of theory is the holistic theory. And Corey 2021 explains that understanding people through social context and focused perspective as a whole. Well-being is influenced by interaction, experience in systems, and context. So now I've given you a little background on the evidence-based part. We can move forward to the interventions. And these interventions are important in the overall community being able to move forward in a positive direction because it's able to be measured and evaluated and documented. The first one is the Wheel of Wellness. And according to Spain 2021, he explains that this is a qualitative, facilitative, and interactive focus group with visual mapping techniques and participatory approaches. And the second one that he highlights is ripple effect mapping, which is also called REM. And they explain that it's a qualitative participatory evaluation method that measures impacts at a county level. And that's really important because it's at the local level. You don't have to wait on your capital or the state of which you're as a whole. It can be something that the community can do. And it's effective with large population programs and a broad range of stakeholders, which is equivalent to a whole community. I want to stop right there. Do y'all have any questions so far?
Yes, we do. We have one question from Stephanie, and she wanted to know if the county health department is a partner in your research.
I will get to that. I do have an
example.
example.
Foreshadowing. Okay, I love it. Thank you for the question, Stephanie. I'll go back on you. That's the only one for now.
Yes, thank you. Okay. So the social determinants of health indicators are highlighted in the integration. And like I said before, it's the medical, behavioral health, and social services. The medical, these are just a few. There's in the research so much more, but I thought these were the top 4 that I really wanted to emphasize today and be able to these are the ones that I think is the most doable or the most achievable and realistic measures. And of course, everybody knows about access to healthcare. That's a top medical one. The behavioral health is social connections and inclusion. And the social services, to be able to increase the number of cohort minority graduations within the 4 years entering. And balance the gross median housing expenses with the gross median income. And people are going to ask, we know this, how are we going to do this? Everybody understands about it, but how are we going to be able to do it at a community level? And this is the example that I wanted to show. This is a cross-sector collaboration team that is active, and this is a replication of how you can integrate it into your community. And to be able to answer that question, it would be under the healthcare system, under the co-chair, which is health clinics. So yes, they are integrated into this collaboration team. And it starts at the president, and then there is a co-chair and secretary and treasurer. And then at the third level, which is all equal, everybody has power and voice and shared consensus in this at the same level. The behavioral health system, the healthcare system, the criminal justice system, the government system, and the educational system. Also, and I couldn't fit it into the same level because of space, but they are as equal and important, which are the funders and foundations, the community stakeholders, private companies, community philanthropy leaders, which are churches, and veteran administrators. And as peer providers, we would be under the community stakeholder category. What would you do if the only provider for that sector, either one, medical, behavioral health, or social service, just one, shuts down and you did not know when it was coming back? Take a moment, reflect. What would you be able to do knowing what you know?
You can share those reflections in the chat. And while you're reflecting, Yvonne, I'm going to share my story from my hometown that my mom told me while
Okay.
people are sharing theirs in the chat. My mom, I'm from a rural area too, and my mom is a public health nurse, and she was working during the pandemic. And they were delivering vaccines, and the person who was delivering that day got in a car accident. And she was the only Spanish-speaking person with the vaccines that had to be temperature controlled. And so that story stuck out to me because if their public health department had shut down, an entire portion of the rural community would not have been able to access vaccines. And they still weren't able to access a Spanish translator that day.
Thank you for sharing that.
Yeah. I think people are doing more of a personal reflection, or they're scripting long ones in the chat. I'll flag you if someone shares one in the chat, and we'll keep it in the Q&A, okay?
Okay.
Tanya shared that she would reach out to nearby resources and she would seek a referral to other counties. Oh, I read that backwards. She would reach out to nearby counties and reach out for a referral for resources. And Stephanie shared that she would probably need to drive like 2 hours to access the service elsewhere, and that has actually happened to her. Yeah, telehealth options is what someone else, Shar from Nevada, shared. Keep them coming, folks. I'll pass it back to you, Vaughn. Those are good ones. We'll save this chat for later as well.
Thank you so much for responding and reflecting and sharing. And that brings me up to when COVID occurred, all sectors of systems were affected, and especially in rural communities, some of them disappeared completely. And I know, for example, that some of the rural communities, like children's thrift stores, some of them disappeared and were not able to be reopened. Especially when school started back up, it was really hard to find school clothes for children with low income families. So I introduced Rick Johnson earlier today, and here he is again. I wanted to be able to give you a visual of what that might look like. And remember, Rick had a lot of positive in his scenario. He did have access to a lot of things that an other person in different areas might not have. So the first step that he would have to take if he got sick and either be medical or behavioral health, or he needed a social service, regardless of how he got sick, he would need to find a provider. And remember, he was self-employed. So self-employment most likely either did not have insurance, or the insurance they did have was too expensive to access a provider. Then he would have to be able to go to the doctor, transport himself to there. He did have a car. And then it took time to see the doctor, to drive to the doctor, time off of work to go to the doctor, and he's self-employed. So he really didn't have anybody to help him when he did have to go to the doctor. So what are the chances of him actually going when he needed it? But all those barriers, he ended up in acute hospitalization. He ended up in the hospital. Now he's having to go to the doctor for sure. But while he's in the hospital, say behavioral health, he gets disconnected with his family support. When you go into a hospital, you might not be able to speak to your family, or you have limited visits with your family, or just a phone call with your family. In all those situations, a peer provider is vital to that care. They're able to provide that connection back to the family and the individual so that they will able to have positive outcomes and continuity of care. So let's go back to Rick when he was 8 years old. That's his mom holding him in this picture. How will she be able to find a provider to be able to take care of him when he got sick? How long do you think she would have? How long will she get there? I'm sorry.
Oh, never mind. I thought your slides didn't change. That's Rick at the bottom. Never mind. Oops. Sorry, I don't mean to interrupt. You're doing great.
Okay. It's okay. Thank you. How will she get there? So maybe she didn't have with Medicaid, she doesn't have a provider. And if she does, it's someone that's, strained or limited. And she doesn't have a car. How will she get there if she doesn't have transportation? And how long will she need to take off of work to get to the doctor? And how long do you think she'll have to take when she's there? And all these are questions like, if you're living in a rural community, how long do you think you need to take off work? How long do you really need to take off to be able to get to the appointment? Once you do find a provider, that's very limited and strained. With all those barriers, the baby ends up in the hospital. Say it's a medical hospital this time. And she doesn't have any family support. It's just her and the baby. She's having to take care of the baby by herself. Again, those peer providers would be vital to her care as well. They're able to help each step of the way. They'll be able to integrate and support her and be able to have the baby have a positive outcome. And I wanted to mention those are steps. It's a mountain sometimes for people to be able to climb when they don't have access that they need to different things. And to be able to get to that support, it sometimes can be very challenging, especially in rural community. So this is a snapshot of the actual Texas Health and Human Services for this area that I did my research in a rural community. And it actually does take 92 miles one way to find a medical provider. And this is showing a prenatal medical clinic. It's a Medicaid provider within 100 miles of Fannin, one clinic to address child health, child dental, and prenatal care. So in order for, once she does be able to provide that transportation or get a ride from a friend, it would take her over an hour just to get there, and not including the appointment and back. And that's just one example of the challenges that families must overcome to get good health and wellness and social determinants of health.
We have good chat going on.
Oh.
We have folks that are sharing that it would take at least a half a day off to go see a specialist in their area, or a half a day off. Specialists in our area are a full day off because some specialties are no closer than 2.5 to 2 hours away. That's from Tanya. And Julie in North Carolina shared that they're experiencing a shortage of direct support professionals in the IDD, which I think is developmental disabilities. I'm a high school educator, as well as a lack of childhood mental health substance use providers for services in such as intensive in-home child mental health and no applied behavior analysis for individuals with autism. And Stephanie also shared that she usually has to take an entire day off work. So yeah, it's definitely, even if you're not in Texas, it's definitely something that's impacting a lot of folks.
Thank you for sharing. The ABA I know is very challenging because that's a very specialized care that's needed to be able to just have that support. So thank y'all so much for sharing, and knowing that it's national wide and not just in Texas is a different outlook. Thank you. So next, I want to be able to discuss the findings or the outcomes that I would like to be able to see is improving access to services and partnerships in rural communities. And these are solutions that actually could help in everybody's area, not just Texas. And be able to improve the overall rural outcomes and community capacity. And that's something I think I just heard is that there's limited capacity to be able to serve and direct services. It increases community involvement and communication, that continuity of care that I was talking about earlier. It improves physical and mental health. It improves behavior across settings. So that could be settings, home, school, community, and easily implemented and flexible in a range of settings, which is important because when you have someone, they need help in one area, but they might not be able to get it in different settings. It's really important that this can be implemented in all of them. And based on these key areas, then the positive outcomes can be beneficial. With these improvements, there can be a suicide risk reduction and a stigma reduction. And integrating of peer providers and an investment in local businesses and educational opportunities, which I was able to witness in a community that's rural. And it is amazing to watch that the communication, the community involvement, and everybody working together and mixing all the sectors together and being able to say, hey, we need to make things better for our community. Some action steps. This is how are we going to get there? So the first step is to be able to share collective power, vision, and investment. And that's what I mentioned earlier was the graph of the cross-sector collaboration. Everybody is sharing the power and the vision and the investment. They are all making consensus-oriented decisions with direct service delivery, which lowers the service delivery gaps. And the conscious awareness of engagement and cultural barriers. It provides a step towards administration, education, and it integrates peer providers or navigators, which I think is a very important step because they do exist. They are around nationally wide. Be able to help in that process would be beneficial. And to be able to work within and support a team-based approach with existing peer providers. They're peer-led and peer-focused sharing and engaged and sustained community social connection. So that's that social context I was talking about. They integrate trained supports in assisting and facilitating connections, communicating empathy and acknowledgement of unique lived experiences, which promotes hope and healing, story of non-isolation. And remember when I was talking about the person sitting in the chair, they felt alone and that risk for suicide. This would help promote the hope and the healing and make sure they don't feel that they're isolated and they are alone. It helps boost community capacity by integrating peer providers into service delivery while ensuring sufficient training to work with families experiencing complex challenges. And be able to work with experienced and trained peer support providers to better understand families' unique needs affected in recovery. And in conclusion, to support questioning of rural communities who do effectively and willingly collaborate, share partnerships and resources, all coming together, all investing in this, they are more likely to improve wellness, expand capacity, and produce positive outcomes in age expectancy in relation to social determinants of health, which is the reversing of the suicide. So how is Rick doing? Unfortunately, he unsuccessfully gained access to community care and resources. He could not address his behavioral health, and he passed by suicide in 2013. And his life expectancy was lower, even with less barriers than most. Remember, he was in a dominant ethnicity, and he was a male, so he had less barriers than most. So that brings me to my call of action, the urgency of why this is so important. And thank you for coming and listening today and be able to for me to be able to share is because is be able to find and connect with your local county's peer provider. Find who that is. Make a connection. And also developing working relationships to create a multidisciplinary team of holistic care in your area and in your community. And this is the references that I mentioned earlier. Thank you so much. I appreciate you attending.
All right. We had a question come in. I'm going to go ahead and stop sharing this for you.
Okay, thank you.
There we go. So now we can see you and we can open up for a Q&A and you'll be able to see the chat if you want. Stephanie asked, how do we improve access? And it's right after you were talking about finding your county's peer providers and creating multidisciplinary teams. Is there anything else that you would recommend to improve access?
My most, and I think the one that worked when starting this process was having those conversations with those other sectors, and saying, hey, what do y'all do? How can we help? And also being consistent in that, like, don't just have that conversation one time, but have it consistently and show up. Because that's one thing that this cross-sector collaboration, there's going to have to be trust established. And so being able to gain that access is have those conversations and consistently have those conversations and consistently showing up to the table.
I think I love what you said, Yvonne. I think it's something that, especially we noticed in my state during the pandemic, and I saw Shar. I hope it's Shar mentioned in one of their comments about working with large remote areas is the showing up. And for my state in particular, working with tribal nations, so many folks just come and go that you don't really get a lot of buy-in with the community to even rebuild those systems until you have spent time to develop the relationships.
Mm-hmm. And I think that's where that social context comes in, is be able to, it is an integrated part into this.
Does anyone else have questions for Yvonne? Oh, well, we have someone in here promoting Project Echo. And Julie, are you from Arizona? Because your name looks familiar. She says Project Echo out of the University of New Mexico, oh, maybe you're in New Mexico, is a model to use to take expertise from rural areas from the experts. So the National Training and Technical Assistance Center is actually partnered with some folks doing echoes. Not all of them are going through NTAC, but they are exactly like Julie described in the chat, awesome models to coordinate and cross collaborate systems with other people from all over the world. I went to one for anxiety, and by the end they were sharing with doctors a whole bunch of different strategies to work with a teenager who was experiencing anxiety. And he was a pediatrician that just wanted better ways to talk to a 14-year-old, and it was really awesome to watch.
I have heard of Echo.
Maybe you can start creeping on them for part of your degree. Does anyone else have any questions for Yvonne right now? All right, well, she and I will be here for the after party. And we're gonna be able to give you a little bit of extra networking time and a little bit of extra time to explore some of the resources. So if you want to click on the little survey button below for the cross-sector collaborations of rural resources survey, you can complete that survey and then poke around at the different options available within the platform and check out the announcement feed to look at when the next session is starting. I am notorious for telling people the wrong time across time zones. So let me double check.
And also, I did provide a resource in the library of family partners in Texas and the information on peer providers that I was able to gather.
Cool. Are there any other resources to share with the group? We can upload them to the resource library, or tips and tricks for working with rural areas. I think I'm able to bring other people on stage. I can. I have the power. Well, everyone, I'm so happy, Yvonne, that you shared your first national presentation with me. I didn't want to tell everybody that right before she started, but she was so nervous because it was her first time and she did amazing. Throw it up in the chat. I wish I was doing all the kinds of work that you were doing when I was getting my undergraduate degree. And the thing that stuck out for me in Yvonne's story was she had to choose between being the only family peer provider in 6 counties and going back to school so that she could continue this work and return back to her rural community. So These resources are definitely needed, and it's so nice to hear from the folks who are living it on the front lines.
Thank you.
We will see you at the top of the next hour for our closing keynote. Enjoy networking. Schedule a meeting with Yvonne. Win the leaderboard. The world is your oyster, and we're so glad to have you here. Bye, y'all.
Thank you.